All right, how's it going, everyone? Today we're going to talk about the very, very interesting medical practice and allied health professionals in today's healthcare environment. Today's healthcare environment, as we've already spoke of, is very litigious, and there's a lot of small pieces and jobs, for that matter, that we have to deal with on a daily basis in the healthcare team sectors. So we're going to talk about that, talk about its kind of basis. So healthcare professionals, of course, they highlighted that as HCPs. We've talked about there's more malpractice cases than any other time. Um, there's a lot of issues that happen quite a bit. There's, managed care companies. We'll talk about that in a little more detail. I also, have an extensive background in health insurance carriers, and that's something really, really interesting. I would heed you to take a look at what the difference between a HMO, a PPO, and a certain plans that they have out there in regards to your health insurance. If you have health insurance, make sure you know exactly what you have before you buy it. There's a lot of stuff out there that's, all in all, not great. So this is what we're going to talk about in a little more detail. Health maintenance organization. It means healthcare services are available to plan members for a premeditated fee. Preferred provider organization. Of course, the patient uses a medical provider under contract, and they get a fee for service. And then an exclusive provider organization is a combo of a PPO and an HMO. You will see a YouTube video under this chapter that you should watch. It goes over what an HMO, a PPO, and an EPO is, and it does it at greater detail than I can, and in also a more effective way. So I would really encourage you to watch that video. It's really important, and it's really interesting. At healthcare.gov, you can look at what an HMO is, what a PPO is, and what the differences is. Of course, everyone uses Google, right? I use Investopedia quite a bit just to take a look at some information based on stocks and stuff. But HMOs, they have a bit of information on them there. If you look at preferred provider organizations, you can find quite a bit online as well. Healthcare.gov has it. And of course, healthcare.gov is the marketplace, the market center, federal market center that started from Obamacare. Of course, it had some hiccups in the beginning, but it seems to be working its purpose. I'm not saying it's the greatest thing since sliced bread, but there's a lot of really interesting things that have happened since Obamacare that people should be aware of. Of course, more people have health insurance, but healthcare costs continue to skyrocket. A bit of information on that. The key thing is looking at that video that we talked about. It's really, really interesting and has a lot of detail that you'll find captivating. Medicare. Everyone's heard of Medicare. It's for the elderly, of course, those who are in need of healthcare coverage at an older age. You're eligible for Medicare. For sure, make sure that you know what Medicare is, but the difference between Medicare and Medicaid is really important. They're not the same. Medicare started in the 1960s, and it's kind of a rationed healthcare system for those who are older and are in need. Mainly, it's overseen by the Department of Health and Human Services, Medicare. And you can find a lot of information. The U.S. Department of Health and Human Services has a lot. CMS, Centers for Medicare and Medicaid, is its own private department. It is massive. And there's a lot of information out there regarding CMS. It's overseen, of course, by the DHHS, which is Department of Health and Human Services, but it deals with Medicare and Medicaid and actually gauges the prices for all reimbursement for hospitals. Medicaid, of course, is a federal program for those who are impoverished that need financial assistance for people that can't afford, I guess you could say, health insurance. There's a lot out there. The difference between the Affordable Care Act, Medicare's always been there since its enactment, so people have been able to access health insurance even when they couldn't afford it. But there was a kind of a middle ground there that we were losing people. So it's really interesting to know the difference between Medicaid and the healthcare exchange, the kind of the lowest point of the healthcare exchange. DRGs, diagnostic-related groups, that's a little bit what we talked about earlier. It classifies a Medicare patient by illness. There's 467 categories, and you reimburse based on that. Bed days are also an issue in regards to hospitals, so they really look at that, and they discourage this says discourages treatment of severely ill patients. Patients are often discharged before ready. I completely disagree with that. Healthcare institutions cannot get away with that. However, it does limit reimbursement for an excessive amount of bed stays. It had gotten to a point many years ago where hospitals were keeping people longer than they should and charging the federal government an excessive amount. But the big argument, mainly by those who want Medicare for all, is that not having the DRG system will place higher likelihood on better treatment for patients, and that's not at all correct. I think there's a fine line that needs to be balanced. The DRG system has worked pretty effectively, but it does have its flaws. It's kind of the best we can do with the kind of case scenario that we have now. Managed care, the ethical considerations behind it. Economic is huge because it helps limit healthcare costs, but is the minimum standard of care provided to everyone? Some people say the better insurance you have, the better care that you get. I don't completely believe that, but there's an argument out there for it. Is there a bait and switch plan? Yes. Patients are often referred to an entity within the organization that they're aware of, the physician's aware of. There's not a lot of outside referrals. Is it the best thing for the patient? It can be, it might not be, but you always have to remember too, doctors are bound by the Hippocratic Oath to do the ethical thing for their patients. So I personally feel that providers do the best they can the majority of the time, and they also look out for patients beyond themselves. That's just my 2 cents, being with provider affairs for an extended amount of time. Fee splitting, there's 2 scenarios. It's unethical for one physician to offer to pay another one for a referral. That's anti issue. That's the Stark Law. That's something that came out quite a bit ago, but it deals with physician-to-physician referrals and getting paid for that. But you also have to look at the franchise. So the hospital in general, it's completely legal to fee split, depending on the managed care system, because we talked about managed care oversees a variety of different practices. And of course you can fee split by doing that, but because that encourages a lower cost for healthcare services. Medical specialty boards, this says PTAs, but you also have a medical specialty board for RAD. There's a lot of information in here that deals with, seeking high quality medical care. There's reviews that happen from patient charts. A lot of interesting information that happens in the medical specialty boards. It's also important that you know that they exist. Allied health professional is, healthcare team members that work alongside the physician. As a RAD tech, you'd be considered an allied health professional, so just kind of keep that in mind. You're a trained personnel when you get out of RAD tech school, so a physician will work alongside you to do what's best for the patient, and sometimes they'll rely on you or your thoughts about certain things. However, make sure to stay within your scope. It's really important that you know your scope and you stay within it so you keep yourself out of trouble. The difference between license and certification we've talked about a little bit, but licensed personnel are here and certified personnel are listed underneath it. It's really interesting. Physician's assistants can write prescriptions, but they're technically certified. A nurse practitioner can also write prescriptions, but they're licensed. There's a lot less headache when we deal with licensed personnel from a provider standpoint, because they don't have to review a licensed person, I guess you could say. They don't have to review or look over those people beyond the facts of credentialing. Physician's assistants different. They have to have their charts reviewed. There's a lot of things that go into it. They have to have a provider oversight. Conscience clause. I'm sure some people have heard of this. Oh, when you believe that something is right, usually it's based on religion, you are not required to do it. So in the hospital setting, let's use the example, everyone's aware of abortion. A provider does not believe in abortion because of his faith. He is not required to give the patient an abortion if the patient asks for it. However, the hospital is required to find an alternative, depending on the state, of course. There's a lot of things that go into this. Patients can always refuse care, remember that, but there is a conscience clause for healthcare professionals, especially when it deals with religious beliefs and activities. To this chapter pretty quickly. Feel free to reach out if you need anything. There's a lot of interesting things. It's a really quick chapter, but remember, big thing, make sure you start your APA paper. Make sure you start research. Make sure that you have information that you need to get that done in a timely manner so you're not kind of doing it at the last minute. I'm able to help you. I'm able to even read over your paper to give you feedback so you get a better score. If you turn it in 3 times before the due date, totally fine. You've prepared, and I'll help you through it. I'll even tell you what you'll get if you hand it in early, with the kind of the lack of the presentation side, because I can't grade that until you actually do it. But the more you prepare, the better you'll do. And I think that's a metaphor for life. The more you prepare at something, the better you're usually going to do. So keep that in mind. Let me know if you need anything. Happy to help in any way I can. I appreciate all your work so far.